What is agoraphobia? There are many different anxiety disorders a person could develop. These disorders are usually characterized by intense anxiety leading to panic attacks. Under the umbrella of anxiety disorders fall the category of phobias, which is intense and irrational fears that lead to panic. Agoraphobia is one such fear a person could have, and it is the most commonly treated phobia in the mental health world. It may not be the most common, but its symptoms are severe enough that treatment is almost always necessary. Agoraphobia is the fear of leaving one's home or safe area, and venturing into the outside world. It is also found in combination with other phobias or obsessive-compulsive disorder. People suffering from agoraphobia usually have panic attacks when they feel unsafe, and these unsafe feelings include when the person is trapped, out of control, or too far from a personal comfort zone. Many people suffering from agoraphobia are confined to their homes or even to a specific room in their home. People with agoraphobia are typically fear of leaving their home for extended periods of time, fear of being alone, fear of losing control in a public place, fear of being in places, such as a car or elevator where it would be difficult to escape, detached or estranged from others, anxious or agitated. There are many misconceptions surrounding people with agoraphobia. First of all, agoraphobia is not a fear of open spaces, nor is it a fear of crowded spaces. While these conditions may exist within a person as well, agoraphobia is specifically a fear of being too far from a normal area, regardless of the crowd. Many people welcome visitors into their home, even if they themselves do not leave. Agoraphobics usually simply need to be in complete control of a situation. Agoraphobia can affect any person, regardless of gender, age, religion, race, ethnicity, or economic status. The disorder is about twice as common among women than among men, however. The conditions usually begins with generalized panic attacks, or slight phobias, and develops into a more and more serious condition. Thankfully, treatment is available. A gradual process of exposure is usually recommended, along with anti-anxiety medication including benzodiazepines, like alprazolam. Antidepressant can also be used. Some therapists will make house calls to help patients with agoraphobia, and alternative treatments like hypnosis are becoming more and more popular in the medical world as a treatment for agoraphobia, and other anxiety conditions. A number of famous people have suffered from agoraphobia in the past, including celebrities. The key here, however, is to realize that there is hope. If you suffer from agoraphobia, ask for help and you can begin the healing process. Are phobias controlling your life? According to the National Institute of Mental Health, NIMH, over 6 million Americans suffer from specific phobias. A specific phobia is an anxiety disorder that is based on a certain fear. These fears vary greatly from person to person, and usually stem from experiences in childhood. Specific phobias go beyond being simply adverse to a certain object or situation, and can actually cause panic attacks. Specific phobias can be difficult to diagnose in comparison to rational fears. There are 6 main criteria points that doctors use to diagnose specific phobias. First, the fear must be persistent and unfading. In some people, this fear may also be felt even if the object is not around, or the situation is not happening, simply because it might be around or happen in the future. The second criteria that must be met for diagnosis is acute anxiety, sometimes even leading to a panic attack, when the object is around, or the person is in the situations. Thirdly, the fear itself is irrational and excessive, because there is no immediate danger. Next, a person will start to avoid the object, or situation, even if this disrupts daily life. Another criteria is that it disrupts life to the point where it interferes with normal daily functioning, and a considerable amount of time is spent worrying about the phobia. Lastly, these symptoms are not attributed to another anxiety condition, or disorder. Fears vary widely, but fall into 5 categories: animals, natural environments, blood and injury, situational, and other. In some cases, treatment is not necessary. For example, if you have a fear of airplanes, you can simply choose not to fly during your life. However, Once the phobia begins to disrupt your functioning on a daily basis, you should see your doctor for treatment. Behavior therapy is usually the best treatment you can get for a specific phobia. With this process, the person is exposed to the object or situation, slowly at first, and, with pictures or visualization. Virtual reality is also great for helping others to overcome specific phobias. It is simply important to seek help if a specific phobia is ruining your life. You can ask your doctor for tips to help you overcome a panic attack, or ways in which to avoid objects or situations in healthy ways. While you may never be cured from your specific phobia, it is totally possible to let it go enough to be able to live your life normally on a day-to-day basis. If your fears and anxiety are holding you back from living the life you want, you're not alone. More than 20 million adults in the United States suffer from an anxiety disorder associated with fears. The good news is that there are studies that show by facing your fears, you can gain the courage you need to overcome other concerns that you may have. Here are 5 tips for facing your fears and overcoming your anxiety. Number 1. Don't go it alone. When you are facing down your fears, it can be beneficial to have someone along for the journey that can cheer you on. Perhaps you know someone who has the same fear as you, that can partner with you so that you can encourage and cheer each other on. Number 2. Boost your confidence. When you are getting ready to stare down your fear, it can be immensely helpful to remember all of the other courageous things that you've accomplished in your life. Remember how it felt to achieve your goal. Recognizing previous acts of courage can go a long way in helping you face your fear. Number 3. Acknowledge the fear. Many times our fears are relegated to the back of our minds, unacknowledged, and ignored. Even when faced with anxiety, we often choose just to feel the issue, and never really take the time to understand our fear. Start paying attention to how your body feels, and acknowledge the sensation as a symptom, rather than something more significant. Number 4. Keep a gratitude journal. There have been many studies over the years on the positive effects of keeping a gratitude journal. These studies suggest that people who practice gratitude had higher levels of positive emotions, a stronger immune system, felt less lonely, and had more happiness in their lives, rather than focusing on the negative in your life. Be thankful for everything that you have. Number 5. Expose yourself to what you fear. Even though it can be terrifying, if you want to overcome your fears, then you just have to face them. Sit down and define the worst-case scenario of the unknown outcome, and realize that the worst scenario rarely happens. Doing this, you'll start to notice that each time you do the scary thing, it gets a little bit easier. Knowing and understanding your phobia is the first step to overcoming it. It is very important to know that phobias are common to people like you and me. Having a phobia does not mean you're not normal. It also helps to know that phobias are highly treatable. No matter how out of control it feels right now, you can overcome your anxiety and fear, and start living the life you want.